So I think we'll get started now. I think everybody's ready, and everybody that was in the waiting room is in. So I'd like to welcome everyone to the February version of the Soil Health Nexus Digital Café series. I'm Paul Gross, an extension educator in Michigan, along with Christina Carell, also an educator in Michigan, and Anne Marie Nardi was from Wisconsin that helps run the controls behind the scenes. And we're really happy today to have our presenter. But before we get into that, just for if you're new to the cafe, who we are as a Soil Health Nexus, we're a university-led team dedicated to increasing knowledge, research-based knowledge for extension educators, and provide resources on soil health education. And our team includes representatives from all of the 12 North Central state regions. Our format today, Dr. Sprunger is going to talk for 20 minutes to a half hour, and then we'll have a Q&A. We'll get all the questions that you might have answered, and then with the time left, we'll go into breakout rooms. And that's, you'll be able to choose which breakout room you want to further discuss this topic. So with that, today our presenter is Dr. Christine Sprunger. She's Associate Professor of Soil Health at Michigan State University, and I'll let her kind of introduce herself, and she's going to talk about some of the work she did at Ohio State. So with that, I'm going to stop sharing and welcome Christine, and we're glad to have you today.
Thank you so much. Let me start sharing my screen here. Oops. All right. Ooh, are you seeing the notes or the actual presentation?
There we're good right there.
Good now. Okay, great. Well, thank you everyone for being here. My name is Christine Sprunger. I'm an assistant professor of soil health based at the Kellogg Biological Station and in the Department of Plant, Soil, and Microbial Sciences. And I just wanted to briefly say to all the Michigan folks on the call, I know this isn't a normal week for us. We definitely have gone through a really terrible tragedy. So just keeping that in mind as we move forward through the week. But today I'm really excited to be able to talk to you all about some baseline of soil assessment work that we did at Ohio State University. And I really think it can serve as a vision for some of the work that I think is needed within Michigan and other parts of the upper Midwest. And before I dive into the talk, I really want to thank a lot of my co-authors on this. This is really a joint effort, a lot of labor of love, led by Steve Coleman and also Laura Lindsay and Leo Deese were really instrumental in getting this data in a way that we could, have it ready and available to share with you all. I think I see some co-authors on the call. Tunsisa, I think I just saw your name. So thank you everyone for all the work that you've done. This was a massive effort. And last but not least, I want to thank the thousands of farmers that participated in this study and really made this assessment possible. So before I dive into kind of the heart of the talk, I always like to open and make sure we're all on the same page in terms of soil health. The most common definition of soil health is the continued capacity of soil to function as a vital living ecosystem that sustains plants, animals, and humans. And of course, the importance of soil health has a lot to do with the ecosystem services associated with improving soil health, whether that be increasing biological diversity, food production, water quality and quantity benefits, and carbon storage. I think one of the really kind of key components to soil health is really this more holistic view of soil testing. We can think of traditional soil testing as mainly relying on chemical indicators and chemical processes, whereas soil health testing is really thinking more holistically and really considering biological, physical, and chemical components. And even though we've seen a huge shift in kind of interest in soil health and really a demand for soil health testing, I still think there are kind of critical components where the field of soil health needs to improve and expand. And one of those is on-farm soil health assessment. So a lot of the published work we see around soil health is largely on station using long-term research trials. And that can be important for linking soil health indicators to environmental outcomes and ecosystem services, but really these soil health assessments need to be conducted on farm. And that's really the motivation for the work that I'm going to be talking about today. It's also really critical that we vigorously vet these different soil health indicators, and that's also another major component of what I'm going to be presenting today. Oftentimes when we have new metrics, new indicators that we're working with, we have a lot of questions in how they respond to various soil types and various management practices. And so that's why we need these baseline soil health assessments to really be able to understand how, like, the mechanisms behind these different indicators. The other thing I want to mention is that we've been getting a lot of feedback from farmers on soil health testing that we've done, over the past 10 years. There's a farmer panel survey conducted by the KBS LTER. It's on its 4th year. And what we're finding is that 96% of farmers surveyed across Indiana, Illinois, Michigan, and Ohio believe that soil health is important, which is great news. But there's still a lot of questions that farmers have about soil health. And these are just some of the questions that I hear repeatedly when I interview farmers about soil health. Farmers are often asking, what is a good soil health value? How does soil type influence soil health? And how does my soil health test compare to my neighbors? And these are really kind of the driving questions that led to this baseline soil health assessment across Ohio. So some just kind of basic research objectives. We wanted to create a baseline soil health assessment to really help interpret soil health values so that these new indicators can be of use to farmers and hopefully help them make more informed management decisions. We also need to understand how soil health values shift by soil type. We know that soil type really drives everything that happens within the soil. And so it's critical for us to understand these metrics over space and soil type. Lastly, it's also really important to explore how management practices influence specific soil health values. I won't be able to get into that because we're still analyzing that part of this really large data set, but I'll definitely point to how we went about collecting management practices across all these different farmer fields, and really just talking about future needs to incorporate management into these soil health assessments. Okay, so which soil health indicators did we really focus on in this study? So the first was really just looking at total organic matter determined via loss on ignition. So this is, of course, an indicator that farmers readily have access to. They can get this from commercial labs, and we know that it's really a compilation of the total soil carbon pool. So it's great for really understanding how much carbon your soil can hold. The one issue is that it's often less sensitive than some other indicators. So it can take decades often to see changes post management implementation. The 3 soil health indicators that I'm really going to focus on are biological indicators of soil health. So we have soil respiration, also referred to as mineralizable carbon. And this is really getting at microbial activity. We measure this using a 24-hour assay. A lot of people will be familiar with the Solvita test. It's just very similar to that in that we're measuring CO2 coming off of a soil sample. Active carbon, also referred to as permanganate oxidizable carbon. What we're seeing with this metric is it's actually reflecting a slightly more processed pool of carbons. What do I mean by that? It actually is slightly less sensitive to recent changes in management, and it's actually a predictor of soil carbon stabilization in some cases. But yet again, it's a really useful metric for understanding the available pool of carbon. And again, it's a really reflective of the total organic matter pool. And then we have soil protein, which is a newer metric, and it is reflecting the organic pool of nitrogen. So how do we go about, oops, having trouble getting to this next slide. How did we go about building this baseline soil health assessment across Ohio? Again, we wanted to take advantage of really several different types of trials that were occurring at Ohio State University. We teamed up with Extension to conduct a wide range of on-farm soil health assessments. Some of those were led by Steve Coleman, largely from the strip trials that were used to inform the tri-state soil fertility recommendations. Another large portion of the soil samples came from a mail-in soil survey that we conducted in collaboration with some social scientists at Ohio State University. So it was kind of innovative in the way that we were able to get these samples. Social scientists are always sending out surveys to farmers across the state. And we really just, as a reward, gave the opportunity to farmers who filled out the surveys to get a free soil health test. And so if they replied saying they were interested in receiving a free soil health test, we sent them instructions on how to sample their soils. And then they sent in a shorter management survey and their soil sample. And then lastly, we also worked really closely with farmers across Ohio, where we would just go to farmer fields and conduct soil health assessments and really let them pick the fields that they were interested in learning more about soil health on those fields. So these samples were collected between 2014 and 2021. And in total, we were able to reach 75 out of 88 counties across the state. And we have a total of 2,442 soil samples. This is a pretty massive data set that we're working with here. Okay, so now I'm going to get into some of the data sets from the actual report. And Christina, if you can just copy and paste the report so people know how to access that. I'm again going to give kind of a broad overview of the results, but there's really a lot to dig into, so people feel free to access that report. So this is just a broad summary table of all of the samples. And again, it's a lot to look at, but we're going to work through it together. So again, this is not considering soil type. I really want to point you to that organic matter percent in the middle. And you can see that across all of these like thousands of samples, we had organic matter percentages range from 0.1 to 9.8%. So that really just gives you the range of soil samples across this data set. And then it's really not even useful to walk through some of these other soil health indicators because this isn't accounting for soil type, which we know is such a driving force. So before we go any further into digging into this data, let's talk about how we considered soil type when looking through these results. So the way that we split up soils was we basically looked at textures that were within a coarse classification, a medium classification, and a fine classification. So if you're a farmer on the call and you know that you have a sandy clay loam, then you might want to pay attention to the medium soil type in this presentation. But right off the bat, we thought it would be helpful just to compare soil type to cation exchange capacity, because we also know that these two things are really closely related. And as we expected, fine soils or had slightly higher cation exchange capacity. Next you have medium, and then the lowest was the coarse soils. And so as I move through these tables, you'll kind of see a theme here of kind of how these soil health values are shifting between coarse, medium, and fine. And so starting by just looking at the coarse soils, again, I know it's not the most fun to look at these different types of tables, but I think it's really informative in terms of just understanding the range of these different soil types. And I think especially for educators on the call, this will be really helpful if you do end up taking soil samples and getting these types of metrics to be able to understand where that field is in terms of these different soil health indicators. And I've highlighted this kind of medium section because the majority of farms for coarse soils are going to be within this medium column. And so, for example, permanganate oxidizable carbon, that medium range was between 388 and 477 milligrams per kilogram. And again, on their own, these metrics are kind of hard to follow, but it's just helpful, I think, to see the ranges in the low, medium, high, and very high categories. And I should say that the way that we calculated these low, medium, and high and very high values is all based on percentiles. So low is like 25th percentile, medium was 50th percentile, high was 75th percentile, and very high was anything higher than 90% percentile. And so next we're going to look at the medium soils, the medium textured soils. So again, you can see that the numbers have slightly shifted up. The ranges have definitely shifted, which is a good thing. This is definitely demonstrating that soil type is driving these soil metrics, and they're responding to differences in soil type. And then lastly, we have the fine textured soils, and these are going to be the highest values across the scale, and just have the highest ranges. So again, I know this is a lot, but the next slide, I think, will help contextualize all of this. So this slide is from an individual farmer field where we sat down with a farmer in Ohio and asked them to pick their best field, and then we asked them to pick a problem field. And then we ran these tests, and we're able to sit down with them and say, yes, for your best field, your active carbon is actually higher than other farms with a similar soil type. But in their problem field, you can see all three metrics here are lower than average relative to other fine textured soils. And so this is really the whole point of this baseline soil health assessment. Prior to having these large baseline assessments, like what's been done in Missouri and also what's come out of the Cornell Soil Health Testing Lab, we weren't able to do that, and farmers didn't know what to do with a 47 gram per soil for total mineralizable carbon. And so this is just a way to contextualize soil health metrics in a way that farmers can easily understand how their values compare to another farm with a similar soil type. So hopefully that is coming through as the really key important point for why we need baseline soil health assessments. So you're probably asking, well, what about management? We actually do have management survey data from all 2,442 soil samples. Again, even though, if we did a strip trial or if we relied on mail-in soil surveys, or if we went to the farmer field and worked with them to pick a field for soil health assessments, we always asked farmers to fill out a management survey for each field that was sampled. And so we have crop rotation information over a 4-year period. We have tillage intensity and the number of passes. We've collected fertilizer and amendment information. We also have demographic information. And so we currently have grad students that are working to analyze this data and really merge the management survey data with these different soil health metrics. And we're really excited to be able to see what that story shows. So really my question to you all, I know there's a lot of Michigan educators on the call, is can we achieve the same baseline assessment for Michigan? So in recent years, my lab has collected about 100 soil samples on farms across Michigan, and I know other professors across Michigan State are also working to collect soil health on farmer fields. And it would be really great to be able to build a database so that we can help Michigan farmers understand where they might be in terms of soil health assessments. And I think it's even more critical to obtain a wide range of soil samples given Michigan's diversity of cropping systems and soil types. So again, I wasn't able to kind of split up the management piece and the cropping system piece in this talk, but in Ohio, we mainly were sampling corn and soybean fields. And I think with Michigan, it's going to be really important to think about blueberry production and cherry production, as well as row crops. So I think it's just a lot of exciting opportunities there. Christina, if you could you copy and paste the second link that I gave you? Because at this point, I want to just mention that there's a lot of new opportunities to engage with researchers at KBS in soil health. So I didn't mention this earlier, but I was a professor at at Ohio State University for several years, and I just moved to Michigan State this past August. And so we're really ramping up our soil health assessments, and we've also are going to have a new extension educator based at KBS, and we also have a new stakeholder engagement specialist as part of the LTAR, the Long-Term Agroecosystems Research Trial. So there's just a lot of opportunities to engage in soil health, and we'd love to stay connected. But really, one of the questions that I'd love to discuss with you all is what's the best way to conduct a soil health assessment across Michigan? And I know there are other people on the call from other states, and be curious to hear if these same types of efforts are occurring where you live. And then the last kind of thing I want to mention is, you know, as we kind of envision a new baseline assessment across Michigan, should we be considering additional indicators? So in Ohio, we really just focused on 3 key soil biological health indicators, especially for that report. But my lab is really interested in thinking about nematodes as indicators of soil health. And thinking more about other soil organisms that could maybe be integrated into the soil health framework. And then, of course, we also need to consider other chemical and physical indicators as well. So definitely curious to hear your thoughts on what other indicators would be really important to include in a baseline assessment across Michigan. So at this point, I'm happy to take any questions. I don't have a formal extension appointment in my role here at Michigan State, but always open to talking about soil health with farmers and educators. So there's my email and website if you want to learn more about some of the work that we're doing. And thank you for your time.
Well, thank you very much, Christine. We really appreciate the work you're doing, and you know, it's something that I think everybody's trying to get their arms around, especially these indicators. And one of the first questions Michaela has in the chat is, what is the best single indicator to assess soil health? What limits makes a soil healthy versus unhealthy?
Yeah, so those are all such really great questions. So in terms of the best indicator, I think that's something that we've really struggled with. You know, that's why there are like hundreds of indicators that we could actually test on different farmer fields. The reason why we're focusing on these 3 is that we know from long-term research trials that these are really just the most sensitive to recent changes in management. And we think that they're actually really informative as well for looking at agronomic performance. And so that's why we focused on these 3. Honestly, I don't think it's helpful to pick one. I think it's probably better to look at 2 or 3. I mean, a good example of this is this soil health test report. So if we just focus on the best field, the active carbon and respiration are high in the best field, but the soil protein has a lower than average value. So this could be telling us that maybe their carbon is at a value that's really good and working for that system, but the nitrogen is low. So that could be something that farmer prioritizes. And so again, I think these different indicators are telling us different things. And so that's why we want a more holistic view of how we are testing these soils. And then what makes the soil healthy versus not? That is the age-old question. I think, you know, at its most basic kind of way of production, if it's, you know, if you can grow a crop and you're getting yields, then it's a healthy functioning soil. But with these baseline soil health assessments, we can understand where you can improve relative to other soils with a similar texture. So hopefully that somewhat answers your question.
Good. I'm going to jump back up. Alyssa had a question. How are you categorizing tillage intensity in the management of the fields?
Yeah, that's a great question. So tillage intensity was really just looking at different types of tillage and thinking about the depth of tillage and again, the frequency. So it's important to distinguish the type of tillage, but also the number of passes that are happening. And in the study that we actually do have management survey data for, where we're just looking at organic farms across a 4-state region, we actually found that the number of tillage passes was really driving soil health indicators more so than the type of tillage that was used. So that's a good question.
Just to kind of follow up on something, did you find a difference between organic farms and conventional farms, or is that too early to tell?
That is one of the main questions that will come out of the management surveys here from this baseline soil health assessment. And I'm really excited to see the number of tillage passes, because that was something that was really shocking to me, to see the number of tillage passes that were happening within the organic farming systems. And I think it will be much lower in conventional systems. So it'll be really interesting to see, you know, where there's kind of benefits of organic production and where there might be benefits of conventional production for soil health.
Okay, thank you. Chuck has kind of a comment. The PLFA is a great baseline test that is pretty easy to understand. So just want to get that out there. Another question, shall we take depth into consideration? We know that no-till systems have more C in the surface and till systems have a deeper layers. If we only look at 0 to 10 centimeters, are we missing anything or missing the picture?
Yeah, another really, really important question. And absolutely, there's actually another study led by Steve Coleman and others where they are looking at soil health by depth across a wide range of trials across the United States. And hopefully they're going to be able to address that question. You know, with this baseline soil health assessment, there was talk of going at different depths, but it gets really complicated really quickly. And I think even in 2014, when I wasn't even a part of the study, some of the strip trials did try to go 0 to 15, 15 to 30, and it just got so complicated. So we just focused on the surface soils.
Okay, Victor, what has a question? What physical indicators do you consider in soil health test?
Yeah, so that's another really great question. There are multiple physical indicators. We tend to focus on aggregate stability. When we do these on-farm assessments, we find that it's one that's pretty sensitive, especially picking up differences between farmer identified best and problematic fields. there's also things like infiltration, or just thinking about overall texture, that are also going to be really important when you're assessing overall soil physical health.
Okay, Chuck has another kind of comment. I find that wet aggregate stability labs tests do not seem to correlate with my field observation of aggregation. Do you have any insight on this?
I think I'd have to know more about how the two different tests were run. I don't know. That's a tough one.
Can I follow up?
Yeah.
What I'm referring to is, number one, well, the Soil Health Institute is identifying wet aggregate stability as one of those top 3 indicators for scaling soil health. I started working with sending in the lab, Oregon State University, back in maybe 2016. I've looked at a lot of wet aggregate stability lab tests, and I'm trained on evaluating soil health aggregation in the field, and I feel like I've become pretty 100% confident on my eyes looking at soil. I just put the shovel test, put the soil to the shovel test. And what a long-winded question here is a lot of times I'll see high scores or relatively high scores, and my field observations are telling me otherwise from, and this is very practical experience. The other thing I'll say too is I've asked many experts, can you provide me some sort of scoring range interpretation for wet ag? And I hear tons of different answers. Some say, well, over 50 or 60%. Some say, no, it's got to be at least 80%. So maybe you can elaborate on wet aggregate stability in the lab a little bit more.
Yeah, I mean, I can try. For every person that I talk to runs aggregate stability a little bit differently. We used a dunker method. We had an engineer, design this dunker for us. We could run like 8 samples at a time using 3 different stacked sieves. But other people are doing it by hand, and other people have other instrumentation so I think there's just not standardization. I think in comparison, these 3 metrics that I shared today, in the past 5 years, people have really done extensive lab to lab comparisons to really make sure that we're processing soils correctly, to really make sure that we don't have a lot of variability. And I think we're making advances, especially on POX, for example. We haven't done that yet with aggregate stability, and I think it's just going to take time. I know people like Steve Coleman are definitely working on that, but I would say it's probably just variation in methodology, and maybe it's maybe aggregate stability isn't as scalable across a farmer field, for example. It probably drastically depends on where that soil sample is taken.
I appreciate that. Real quick follow-up. I know there's other questions. Can you explain maybe the difference between the permanganate method and looking at active carbon through water extraction? And because the Haney test is water extraction, and just I'm hearing, just be interested in your input on that. And
yeah, so the permanganate oxidizable carbon is based on a chemical reaction, and what we've seen over time is that it's most effective when you are able to compare it alongside respiration, just because these 2 indicators are really reflecting different pools of carbon. The Haney test is a compilation of a variety of different metrics, and I think it's, in my opinion, not quite as informative in terms of function, and really getting at the early indicators of carbon sequestration. And so I prefer the active carbon test, or permanganate oxidizable carbon, but others on the call may have differing thoughts on that.
Well, the water extractable organic carbon would be considered the active carbon pool. I guess that was my question. Do you think it's looking
Yeah,
at the same fraction? Is that even possible?
I
Yeah.
think there's a lot of discussion on what active carbon is. Some people are even uncomfortable calling POX active carbon at this point. We're seeing that it's actually more of a process pool and it's probably more of an intermediate carbon pool. So probably in theory, they're both reflecting active carbon, but as we learn more about these different metrics, they're likely reflecting slightly different functions.
Thank you. Very good conversation. Appreciate that. Marcel has a question. How variable are each of these measures throughout the season or in response to a precipitation event?
Yeah, so I almost added a slide on this and thought I had too much to share. They're extremely variable, and I'm really glad that you brought this up because it's so critical in terms of like if you're going to monitor this, maybe you're going to test your soils every 3 years, you're going to want to sample at the exact same time, very similar parts of the growing season. Maybe you want to sample before planting or right after. But these are very variable. I can even share a link to one of the papers where we looked at POX and respiration over the course of a growing season. Let me just do that really quickly because it is, especially respiration is super sensitive and will pick up drought and respond to major rain events. So a really important question.
As we wait, I'll just remind everyone before we go into the break that our next cafe is going to be March 15th. Dr. Andrea Blesch from the University of Nebraska-Lincoln and Fernanda Krupek are going to be our presenters. So stay tuned for that. As you're working on that, Christine, there is a question that came in on how you describe or calculate or categorize tillage intensity.
Yes. I just copy and pasted a link. So let me get back to the presentation. So there's all sorts of ways in which we can actually calculate tillage intensity, and I should have copied a link to our management survey because it's very easy to see kind of how we described tillage intensity, and farmers could really pick the different types of tillage that they were using on their operation. But then there are also different calculations like the STIR values that you can input tillage intensity based on age-old kind of metrics, as well as including the number of tillage passes. So there are online kind of resources where you can calculate that. And as a group, we need to decide how we're going to actually calculate that once we process more of this management survey data.
Okay, Victor has another question. Secondly, can incorporating stable isotopes, particularly N and C isotopes, help predict long-term soil health?
Yeah, I think if your goal is wanting to understand soil carbon stabilization, maybe you're interested in really looking at cover crop inputs and how they're contributing to soil carbon accumulation. I think stable isotopes are a great way to assess that. The problem is stable isotopes are really expensive to work with, and we often just work with them within kind of long-term research experiments where we have more controlled environments. But that's certainly a tool that would be helpful, I think, in understanding these different pools and how they're, ultimately contributing to carbon sequestration.
Okay, Dan has a question. How do you value soil respiration and microbial biomass as soil health metrics?
Let's see if I'm going to reread that. How do you value soil respiration, microbial biomass as soil health metrics? Okay, so how do I personally value them? I think respiration is probably going to be the most informative soil health indicator, at least of the ones that I talked about today. It's really responsive to management, and it also tracks often with your total soil organic matter pool. Microbial biomass is useful in certain instances. I've found that it's not as sensitive to differences across farmer fields relative to respiration. When we think about these different indicators too, we have to think about cost and how quickly we can run these samples, which is really important for scalability. And I think respiration is just an easier metric to scale relative to microbial biomass.
Okay, thank you. Could I ask you to quit sharing your screen?
Yeah.
And we're going to get ready to, I'm going to share my screen again and kind of move us into the next stage. As we go into our discussions, the discussion will include the impression of the topic, any current research that you think supports the discussion. How can we use this information in the future? Any future topics for the webinar? And then I'd just like to thank again everybody for joining us today. I'd like to invite you to join us on March 15th when we're going to have Dr. Andrea Besh and Fernanda Krupek, PhD graduate student from the University of Nebraska-Lincoln. They're going to talk about impacts of and benefits of cover crops and some of the work that they've been doing. So with that, thank you. Please feel free to pick the breakout room you'd like to go to and enjoy your conversation and enjoy the rest of your day. Thank you.
Thank you. We're going to put up your breakout room choices. I do want to take this time to thank Paul. For those of you who are not in Michigan, may not realize that Paul is retiring at the end of the month, and he's done a lot to start the Nexus and to serve the Nexus. So we, as a whole and as a group, want to say thank you, Paul, and your work will continue.
Thank you.
So folks should be able to click breakout rooms at the bottom of your screen and then choose the room that makes the most sense for you. Educator, researcher, agency, student, or producer.
Jamie, can you go down the bottom of your screen? Do you see a breakout button? Or did it pop up? It should have popped up on your screen.
It did not pop up on my screen.
Okay, where would you like to go? We'll move you.
Okay, I'm an educator. You can put me with other educators.
All right, we will go ahead and do that.
Thank you.
Yeah,
Anyone
me too.
else
I see it.
having
I
issues?
can put me in them like researcher, please.
Are other folks having issues?
Yeah, I don't see it on mine either. I'm producer, please.
Okay, actually, I think we're going to close them and reopen them. It may have been that, Christina, we didn't click that folks can choose their own before we let it go. So sorry about that. All right, I did just reopen them and make sure that you can check your own. So can folks let me know if they're able to see
We're there now, Anne. It looks
Okay,
good.
great. Thank you, Taylor. So yeah, you should be able to see breakout room at the bottom there and then pick the breakout room that works for you. I apologize about that. Sorry, Christine, I had to kick you out and then you can go back in though. I apologize. Other folks, it looks like are joining. Just had a little bit of an issue starting those breakout rooms.
I could not join any breakout room. Please can I be added to the students room?
Great, will do. Looks like the educator rooms and researcher are the most popular, followed by agency. Don't have many folks in the student or producer group if folks are willing to join those.
So still have a couple, looks like they're struggling. There. So Anne, I have a hard stop at 4. I'm just gonna leave my computer on. I guess I could stop recording because it doesn't record anything.